Thank you. Mr. Speaker, it's my honor to rise today as co-chair of the Bipartisan Rural Health Caucus to commence hosting this special order hour in celebration of National Rural Health Month. Every year, National Rural Health Month is a time for us all to bring attention to the unique healthcare needs in rural America and honor the incredible efforts of rural healthcare providers, organizations, and other stakeholders. It has been more than a decade since Congress last had a bipartisan coalition focused on promoting and advancing healthcare solutions for our nation's rural and remote communities. Sadly, during that time, the prognosis and progress has only gotten worse for those who live in rural America. The health and wellness of our people has not improved. Especially given the divisions in our country and in Congress today, we need to find more ways that we can come together around common issues and common ground and develop solutions that ensure rural Americans do not get left behind. That is one of the reasons why earlier this year I relaunched the Bipartisan Rural Health Caucus with my distinguished colleague from the great state of Tennessee, Diana Harshbarger. Earlier this year, we came together with a shared desire for Congress to play a more active role in improving and promoting life and access to health care in rural America. Today, nearly 50 members of Congress, Republicans and Democrats, have joined the Bipartisan Rural Health Caucus, representing rural areas across the country from Guam to West Virginia, to the Upper Peninsula of Michigan, down to Central Texas. Whether political, demographic, or geographic, the diversity of our caucus is our strength because rural America is America. At this time, I'd like to yield to my distinguished co-chair, Diana Harshbarger.
Mr. Speaker, I rise today to recognize National Rural Health Month and to highlight the work of the Congressional Bipartisan Rural Health Caucus, which I am proud to co-sponsor with my colleague, Representative Tokuda of Hawaii. Over 60 million hard-working, everyday Americans live in rural communities throughout the United States. And as my co-chair, Rep. Tokuda, is fond of citing, with nearly 97% of our nation being designated as rural. Compared to their counterparts living in urban and suburban areas, rural Americans experience lower life expectancy, poorer health status, and more difficulty accessing quality and affordable health care. Rural patients face these challenges due to a limited number of rural health care providers and professionals, higher rates of uninsurance and underinsurance, and long journeys to care providers, sometimes lacking transportation entirely. Having served as a community pharmacist in East Tennessee, which is a rural area, for over 30 years, I understand the unique healthcare challenges and obstacles faced by our patients and healthcare providers each and every day. It's crucial that Congress takes actions to address the issues that rural healthcare providers grapple with, such as workforce shortages, supply scarcities, reimbursement challenges, limited access to telehealth, and difficulties ensuring their patients receive the care they need. The Congressional Bipartisan Rural Health Caucus is here to provide a forum for members of Congress to advocate for legislative action that will help increase access to quality, affordable health care and mental health services for all rural Americans. As co-chair, I will continue my work to advocate for legislation and policies that will ensure long-term sustainability of rural communities. Earlier this year, I introduced the Bipartisan Rural Physician Workforce Production Act, which improves Medicare reimbursements and enhances the current structure of the Medicare-funded graduate medical education program, bringing more medical residents and doctors to rural areas in need. I also work with my fellow colleagues from the Tennessee delegation to introduce the Rural American Health Corps Act, which would provide incentives for healthcare professionals to work in rural health facilities in exchange for forgiving medical student loans. In addition to these bills, I'm a proud co-sponsor of the Save Rural Hospitals Act, a bipartisan legislation that will aid in curbing hospital closures in rural communities by ensuring fairness in Medicare hospital payments. This legislative work is absolutely critical and complements House Resolution 870, which I introduced with the majority of the members of the Rural Health Caucus to support the goals and ideals of National Rural Health Day. National Rural Health Day, the third Thursday of each November, was established to honor rural communities and the contributions and efforts of rural health care providers to address the unique challenges faced by the patients they serve. Given the aforementioned healthcare disparities faced by rural Americans and the continued difficulty experienced by rural healthcare providers in keeping their doors open, it's vital that Congress prioritizes improved patient care and access in rural areas. Our rural healthcare professionals and patients showcase a selfless and community-minded spirit, and it is altogether fitting and proper that we celebrate rural healthcare providers and the millions of Americans that rural healthcare providers serve and express a commitment to advancing policy to improve healthcare accessibility and affordability in rural areas in our country. Mr. Speaker, I thank Representative Tokuda and my colleagues for joining in this cause, and I yield the balance of my time.
Thank you, Mr. Speaker, and mahalo to my co-chair, Representative Harshbarger, for providing leadership and insight for many, many years on this particular area and serving on the front line as a pharmacist in her own community. At this time, I would like to yield the floor to Representative Kilmer from Washington.
Thank you. I thank my colleague for yielding. Speaker, 49 years ago in Port Angeles, Washington, I was born in what was then called Olympic Memorial Hospital. Over the years, members of my family and I received good quality care from what is now known as Olympic Medical Center and its well-trained physicians and nurses, and from a staff that genuinely cares about the community. But the future of health care in rural communities faces extraordinary challenges that threaten the ability of folks to access the care that they need and that they deserve. Unfortunately, the reality for many Americans in rural areas when it comes to health care is a story of gaps and barriers. And this isn't just a problem for the Olympic Peninsula. Rural populations often bear the brunt of healthcare disparities. They're usually older, have less income, and often have complex health issues. These factors burden rural hospitals, many of which are already buckling under pressure. In fact, today, the rural hospital closure crisis threatens more than 400 rural hospitals nationwide with imminent closure. For folks on the Olympic Peninsula, quality care should be readily accessible, not a service only available in the shadow of the Space Needle. No matter who you are or where you're from, you ought to be able to find quality, affordable medical care close to home. This rural-urban healthcare divide is a crisis that demands attention from Congress. An important piece of the puzzle is addressing the site-neutral payment policy, which has significantly impacted rural hospitals, like Olympic Medical Center. This policy, originally intended to equalize payment rates between hospitals and outpatient clinics, often disadvantages rural hospitals, which rely on higher reimbursement rates to maintain operations and provide essential services. By advocating for an exemption for rural sole community hospitals from this policy, we can ensure these vital institutions receive adequate funding. In addition, in July, I introduced a bipartisan bill known as the Rural Hospital Technical Assistance Program. This bipartisan effort would provide targeted, in-depth technical assistance to vulnerable rural hospitals and communities struggling to maintain healthcare services. That means helping to prevent closures, strengthening essential healthcare services in rural communities, and improving financial and operational performance. Our bill seeks to alleviate the strain felt by many rural providers by authorizing new federal funding to support improvements to these crucial facilities, aiming to ensure that everyone, regardless of where they live, can stay just as healthy as someone living in a big city. Consider the hypothetical but very real situation of an older patient with cancer in Port Townsend who receives chemotherapy multiple times a week at Jefferson Healthcare, or the pregnant mother in Elma receiving prenatal and obstetric care at Summit Pacific Medical Center. Without strong rural hospitals, these patients and others may face a long and burdensome commute to an urban hospital or go without care entirely. The Rural Hospital Technical Assistance Program aims to mitigate these very real scenarios and keep facilities open and thriving, ensuring that everyone can access medical care near home. Our bill is important in bridging the gap of healthcare disparities that we see every day. It aims to prevent the unfortunate and unnecessary closure of rural hospitals and to ensure that folks in rural communities receive the care that they need and that they deserve without the necessity of long-distance travel or facing financial ruin. It isn't just about keeping open facilities like Olympic Medical Center in Port Angeles or Peninsula Community Health Services in Kitsap, Mason, and rural Pierce counties. It's about keeping people healthy, employed with good-paying jobs, and improving care in rural areas where the need is most critical. The Rural Hospital Technical Assistance Program is a commitment to equity, a promise of access, and a crucial step toward ensuring that going forward, quality health care isn't a privilege confined to big cities. We deserve a future where care is not constrained by geography, but is easily affordable and accessible for all. And again, I thank my colleague for organizing this special order, and I yield back.
Thank you very much. At this time, I would like to yield the floor to Representative Lamalfa from California.
Thank you to my colleague and friend from Hawaii. I'd like to chime in as well on this issue with the importance of improving, expanding rural health and the challenge it really is in our most rural areas of our country. In my own Northern California district, we have several high country hospitals are out on their own pretty much. And so the connectivity that we need to have for them and the challenges on, some level of equality on reimbursements is extremely important. So I'd be happy to join up with your effort, Rep. Tokuda, on your caucus there. So indeed, as we expand and get more and more telehealth opportunities, as well as something that's worked pretty well for us in our district has been teaching health centers, getting young folks as students and as maybe young doctors to want to work in our communities here as well. It just helps expand the opportunities for people that do live in these rural areas and don't have nearly the choices. That's part of the cost, I guess, of living in a rural area. But we've done a lot of good work with the USDA, expanding fiber optic, getting more and more connectivity, and we need to keep doing that in order to be more successful for rural America. So I appreciate this effort and the bipartisan effort it is, and I yield back.
Mahalo, Representative Lamalfa, and I will say a great deal of gratitude for helping to guide us through a crisis that is hitting rural America far too often, natural disasters as we are seeing it, and look forward to also now working with you to make sure that when disaster strikes, our healthcare system providers will be there to support them every step of the way. Thank you very much. At this time, I'd like to yield the floor to my agriculture chair, actually, Representative Thompson from the great state of Pennsylvania. He often says food is medicine, and so appreciate his guidance and wisdom on this particular issue.
Well, Madam Chair, thank you so much. Thanks for your leadership with this Bipartisan Rural Health Caucus. Incredibly important, really defines my life prior to coming to Congress here 15 years ago. I spent 28 years working in rural health care, nonprofit community health care, therapist, rehab services manager, manager within rural hospitals, licensed nursing home administrator, and witnessing firsthand the challenges that individuals that live in rural America, rural communities face when it comes to health care. Acutely aware of the challenges many face when it comes to obtaining reasonably priced health care. And it's especially critical for rural areas like much of the 15th Congressional District of Pennsylvania that I have the privilege of serving today. And as a member of Congress representing nearly 1/3 of the landmass of Pennsylvania, one of the most rural districts east of the Mississippi, I'm keenly aware of the problems my constituents face when accessing medical services. I always say that when I see rural hospitals in dire challenges, and we're struggling with some of that right now in my district, that the end result results in a commute that can mean the difference between life and death, to be able to get the services they need within the time frame that's required. I saw that firsthand, additionally, quite frankly, as a volunteer firefighter, emergency medical technician for several decades. And the importance of being able to get from that accident scene or from their home to a healthcare setting, a hospital setting, on a timely manner, especially those who eventually would require some type of surgery. We talk about the golden hour. It's not an hour in many parts of rural America. So we're facing a healthcare crisis in our nation's rural areas. These often disadvantaged populations are still struggling to access affordable and quality care. Many remain uninsured, most are underinsured. However, access to quality care remains the largest challenge. And even if it's not the bricks and mortar, and we've seen so many of those close over the past 15 years, but it's the talent, the skill, the expertise within that bricks and mortar, the physicians, the nurses, the technicians. It's a difficult, as someone who used to participate in recruiting this talent into our rural hospitals, it's very challenging to get that, to be able to be successful with that. That's why I'm a big fan of telemedicine. and really excited about the advances that we've made in telemedicine over the past decade or so. More that needs to be done. Even when people gain access to health insurance, it does not equal access to health care. Rural hospitals across the country are closing, leaving patients without access to the emergency rooms and long-term care facilities. Quite frankly, where they're not closing, they're always struggling for staff. And if you don't have access to qualified health care professionals, I don't care how we pay for health care, what kind of shiny package, what ribbon we put on it, there is no access to health care without those qualified, highly skilled providers. And so I'm proud to work with you as a part of this caucus, proud to be a founding member of the Rural Health Caucus, proud to work with you as a great member of the House Agriculture Committee, where under the Rural Rural Development title, we support facilities like nursing homes and rehabilitation centers and hospitals, and provide community reasonable funding to be able to address that need. So this is a problem. It's a multidimensional problem that requires a multidimensional solutions. I think that the formation of this caucus is one of the first best starts to address this. So this bipartisan group will bring awareness to these unique challenges to other members and actively work to find solutions to these problems. Thank you so much for yielding the time, Madam Chair, and I yield back my time.
Thank you. Mr. Speaker, as you can see, we have strong leadership across this great country that's making sure that the health and wellness of rural America is taken care of. And so appreciative of all the members of our caucus that have stepped forward and stepped up, not just now, but in so many years past, and will definitely be part of that leadership team going forward. At this time, it looks like it's a great day for the great state of Pennsylvania. I would like to yield my time to Representative Susan Wild.
Thank you very much, and I thank the co-chairs of this caucus for forming the Rural Health Caucus, something that is long overdue and very much needed. Mr. Speaker, this Rural Health Month, I am thrilled to join my colleagues in the bipartisan Rural Health Caucus to advocate for quality, affordable health care in every community. Our neighbors living in rural areas face unique health challenges, a substantial one of those being medical personnel shortages. In the Commonwealth of Pennsylvania, 26% of residents live in federally designated health professional shortage areas, meaning that nearly 1/3 of Pennsylvanians live in an area without sufficient medical personnel. Now, I don't know the last time you went to Pennsylvania, but it's a big state. And if you're in a part of the state that doesn't have a lot of healthcare professionals, you're looking at long drives before you can get to a doctor or hospital. Preventive care is critical to overall health and well-being, and access to preventive care relies upon having an adequate number of medical professionals. And having an adequate number of medical professionals relies upon not being penalized for serving as a teaching hospital. So it's unbelievable to me that this is a problem that Pennsylvania rural hospitals are facing. That's why I partnered with Representative Muser to introduce the Bipartisan Fairness for Rural Teaching Hospitals Act. This bill would allow rural hospitals, including St. Luke's Easton Campus in my district and St. Luke's Miners Memorial Hospital, a stone's throw away, to receive fair reimbursements from the Centers for Medicare and Medicaid Services. This legislation is critical for allowing our rural hospitals to attract, train, and retain talented healthcare professionals to our communities. I firmly believe that access to high-quality, affordable healthcare should not depend on your zip code, and this bill is a step toward making that a reality. I am so proud to join my colleagues in the Bipartisan Rural Health Caucus to find ways to ensure that Americans in every corner of our nation have access to the care and resources they deserve, and I will keep up the work until that mission is fulfilled. Thank you, Mr. Speaker. I yield back.
Thank you very much. Mr. Speaker, unfortunately, the sad reality is that if you're living in rural America, You are more likely to experience lower health expectations, lower health quality, lower life expectancy, simply because of your ability to access health care that you need. I've sat with constituents in my community of Waianae who have asked me if it was fair that people that live right down the road in urban Honolulu live 10 years longer than they do. While at times it may seem that they may require more medical attention and care, rural Americans often have limited access to health care because of such things as you've heard of today: physician shortages, lack of reliable and affordable transportation options, insufficient health insurance coverage, and an increased exposure to environmental and occupational hazards. As the representative in Congress for one of the most rural and remote districts in the country, I know that many of my constituents are often just one diagnosis away from a serious illness, and that the difficult financial and family decisions that often come with this. Across the country, more than 60 million Americans, about 1 in 5 Americans, live in rural areas. And while they make up just 18% of the total U.S. population, they are scattered, as we have heard, across 97% of our country's land area. Rural Americans face numerous health disparities as compared with their urban counterparts. Rural Americans are more likely to die from heart disease, cancer, unintentional injury, chronic lower respiratory disease, and stroke as compared to their urban counterparts. Unintentional injury or death, and you heard Representative Thompson talk a little bit about this in the golden hour, they're more likely by 50% higher rates to die in rural areas as compared to urban areas, often because of their ability to access emergency care when involved in a motor vehicle crash or opioid overdoses. There are so many stats that we can continue to go on and talk, but I would like to have us hear from another part of our great country and our rural caucus, that of the great state of North Carolina. At this time, Mr. Speaker, if you will, I would like to yield the floor to Representative Dawn Davis, another distinguished member of our Rural Health Caucus.
Mr. Speaker, and to our co-chairs, thank you. I rise on behalf of Eastern North Carolina to address my highest legislative priority: improving access to health care in rural America. In honor of National Rural Health Month, I join my colleagues here to speak about how we can find common sense, bipartisan solutions to the most pressing challenges facing our healthcare system. Since taking office in January, healthcare has been my #1 legislative priority, having led, co-led, or co-sponsored more than 60 bills in this space. As we are here today, the people of Eastern North Carolina are hurting, and at the root of this pain is a lack of access to health care. To tackle these health disparities, I joined 2 colleagues in restarting the State Medicaid Expansion Caucus to demonstrate the overwhelming public support for basic access to health care. After more than a decade of waiting, or in some cases, dying, over 95,000 Eastern North Carolinians will gain access to life-saving health care starting this Friday, December the 1st. As a co-chair of the State Medicaid Expansion Caucus, I will continue leading the charge in Congress to expand Medicaid across the country. Beyond Medicaid expansion, I've championed the cause of rural hospitals. In the past decade, 4 rural hospitals in Eastern North Carolina stopped operations, creating significant barriers to life-saving medical care. Martin General is the most recent example of suspending operations in the East. While we have limited tools at our disposal, especially in communities where the payer mix skews towards Medicare and Medicaid, the Rural Emergency Hospital Designation Authority is a critical part of the solution. As Eastern North Carolinians grapple with limited access to care, the opioid epidemic continues to plague the region. To combat this crisis, I introduced bipartisan legislation with Congressman John Rutherford to stem the flow of counterfeit substances, including fentanyl. that have flooded the drug market. H.R. 4988, the Modern the Pharmaceuticals Act will come down hard on counterfeit controlled substances by requiring on-dose identifiers to guarantee the legitimacy of pharmaceuticals. I urge my colleagues to support this legislation and put a dent in the fentanyl crisis. While Eastern North Carolinians and Americans across the country suffer from opioid addiction, patients recovering from injuries face their own barriers to treatment. To ensure our most vulnerable patients get the care they require and deserve, I will soon introduce legislation to cut red tape for physical and occupational therapists, streamlining the delivery of care for patients recovering from debilitating injuries. If passed, the legislation would ease the burdensome plan of care requirements that currently prevent payment for physical therapy services until the therapy provider receives a physician-signed plan of care within 30 days of a first evaluation. No patient should ever have to wait unnecessarily for vital health care services, including outpatient services. As a member of the Bipartisan Rural Healthcare Caucus, you can count on me to champion the causes of patients, healthcare workers, and providers alike. We all have a responsibility in the greatest nation on earth to deliver a standard of healthcare befitting this greatness. Thank you, and I yield back.
Anyone else here? No one else here? Okay. Thank you, Mr. Speaker. Again, as you can hear from across our country, we have strong leadership in rural health, much action to be taken, and much opportunities that we need to make sure that we seize. Now, we've talked a lot about rural America from California to Pennsylvania to North Carolina. I'd like to bring us back now to Hawaii. It is the most isolated archipelago in the world, with the nearest landmass over 2,300 miles away. And I can tell you it's a long distance, given that I travel it pretty much every weekend, crossing that great, beautiful blue Pacific Ocean. In my district, which represents all of the islands in Hawaii, on our neighbor islands, patients often have to fly to Oahu, our main island with Honolulu, to get emergency or even very routine medical or dental or mental health care, while many Oahu-based providers often spend their weekends, if they can even reach there given availability of air transportation, traveling back and forth between our islands just to try to make sure our patients get the medication, services that they need to survive. Now, I know a lot of people are thinking, well, we've got telehealth now. That should be no problem. Again, consider the remoteness of our islands and the remoteness of so many of our rural communities. Broadband speed and access is not equal everywhere across this great country and our territories. So oftentimes, people are just asking folks to pick up a phone to be able to triage and immediately start to provide care and scripts in many cases that people need because they're living in isolated and remote parts of rural America. As in many other parts of this country, in Hawaii, we are seeing providers, hospitals, clinics struggle to keep their doors open because of high operating costs and insufficient reimbursement rates. Since 2010, and it was alluded to earlier in this discussion, 155 rural hospitals have closed their doors, making the difficult decision to leave their patients behind. Often these patients aren't just patients, these are family members, neighbors, and friends with limited health care options and access. We know that for so many of these individuals, those hospitals, those providers closing their doors, it's a life sentence. Now, you'd think after these last, 15 or so years, are we out of the woods? Well, think again. Over 40% of all rural hospitals are operating with negative margins and are vulnerable to closure. This is on top of the fact that rural communities often have fewer healthcare providers. Over 50% of rural communities and counties have no access to hospital-based maternal care. So that means just being able to go somewhere to be able to have your child safely. And 70% are lacking even a single psychiatrist in their county. Just looking at the stats when we think about it, just basic physicians, general internists, doctors, In rural communities, you have 13.1 physicians per 10,000 people as compared to 31.2 in urban areas, less than half the amount that urban America is able to enjoy. And when we're talking about specialist care, which if we think of our own situations, how often you'd need that specialist or a loved one has needed a specialist to provide life-saving care for them, rural America has 30 specialists per 100,000 individuals, as compared to 263 specialists per 100,000 people. We can see the disparity. Sadly, we can see the great need that exists in rural America right now. Now, high costs also are proven to be a significant barrier, whether it is providing housing for recruiting, retaining healthcare workers in our state, to cover medical transport via medevac, airplane, or helicopter, considering even the wages of professionals. But these are all things, as you have heard today, that we have legislative bills that we are trying to focus on making sure that these barriers no longer exist, reducing, again, the challenges to accessing healthcare in rural America. Mr. Speaker, at this time, I would like to, we will soon hear from another great state in this particular country who will be arriving shortly. So let me at this particular time, again, take this back to my hometown of Hawaii. As I mentioned a little earlier when Representative LaMalfa came up, we have seen such devastation in my district with the Maui fires. And the response in the wake of this disaster has really highlighted to us the importance of making sure you have a strong and robust healthcare system, from health critical access care, personnel, medical countermeasures, and supplies. You have to have them ready and on site, because in so many cases, our rural communities, whether you live on islands or there are hundreds of thousands of miles that separate you from the nearest access point, help can often be days away. On the onset of our fires, I remember our chief of police telling us that we have often been told, and sadly now we see it, that if we are in a crisis, we are 72 hours away from help. And so we have to make sure, especially when it comes to critical access care and health care, that we have the supplies and personnel in all of our communities to be able to help respond to disaster when she strikes. My district also has one of the most unique, racially and ethnically unique populations in the country. And these communities often experience, sadly, some of the highest health care costs and suffer from some of the highest health disparities that we see across the country. Mr. Speaker, now again, the wonderful aspect of this caucus, it is both bipartisan and represents all of America. So at this time, I would like to yield the floor to Representative Bergman from Michigan.
It's so interesting to walk in and wonder if you've walked into the middle of something. Thank you, Madam, and I appreciate the gentlewoman for yielding. And I'm honored to join my colleagues today in highlighting the accomplishments and the ongoing challenges facing high-quality health care access in rural and remote parts of our country. And believe me, it covers a lot of our geography. Healthcare providers in areas like Michigan's 1st District face unique struggles in maintaining financial stability while providing the best possible care. Struggles unlike anything facing those in urban or suburban regions. As a result, we have seen a significant increase in rural clinic and hospital closures over the past decade, and many of those still operating today are doing so at the razor's edge. A single provider closing their doors could result in patients having to travel hundreds of miles farther to receive any kind of care. While the situation remains serious, we have seen promising improvements for rural health, especially when it comes to telemedicine. The pandemic underscored the need for and the efficacy of telehealth, especially for those in rural areas who would otherwise be forced to travel multiple hours just to receive a routine checkup or consult with their doctor. Congress must act to permanently extend pandemic telehealth flexibilities, help providers and their patients get the tools they need to utilize telemedicine, and continue to reduce government-imposed barriers. I also want to highlight the importance of the 340B drug pricing program, which provides discounted pharmaceutical products to providers that care for a disproportionate share of uninsured and at-risk patients. In my district alone, we have 20 340B hospitals helping care for our most vulnerable patient populations. These hospitals provide the best care available. The 340B program has been a critical component of healthcare for so many Michiganders since its inception, and I hope to continue working with my colleagues to ensure its lasting success, especially as the program faces new challenges that threaten its integrity. I know our rural and remote providers will continue to do everything in their power to provide top-of-the-line care to their patients, and in turn, Congress must continue to address rural health priorities and remove the barriers to their success. With that, I yield back.
Thank you, Mr. Speaker. As you've heard today, so many tales of tragedy, of disparity across our country in rural America, but also through the legislation, bills, and advocacy that we have seen from our Rural Health Caucus members, so many opportunities for us to do good by rural of America. You know, as I close today and appreciate all of our members that have come forward to share their stories from across this great country, you know, I wanted to highlight an article that was recently run in the New York Times that focused on the fact that more people in Puerto Rico are dying, sadly, at higher rates because of these healthcare disparities and lack of access to a health system. You know, as we take a look at the numbers, as we know, Puerto Rico, again, devastated by natural disaster, compounded by COVID-19, already stressing a very strained healthcare system, lacking professionals in the community to be able to serve their residents. The fact that they only have one working ambulance for 25,000 people in a town, and too often by the time the call is made and the ambulance shows up at the home, those people have already passed away. The fact that they have had 35,400 deaths last year in 2022 for a population of 3.3 million. Again, thousands more than researchers could ever have expected. Historical highs that they're seeing compounded and as a result of a strained healthcare system that is unable to take care of its people's stories. Examples of veterans who have served and fought under our flag that you stand before right there, not being able to access the critical care or even the basic care that they need, they deserve, and they have fought for. You know, again, too many people dying as a result of a lack of access to health care. And when we take a look at the numbers, the disparities in terms of increases in Alzheimer's, substance abuse, mental health causes, chronic health conditions like blood pressure, diabetes, kidney failure, respiratory failure, all of these things. To me, as I read this article and all of the problems that they cited, lack of facilities, lack of professionals, you know, too many of the young ones leaving their community to go and work in the United States or to take on other professions, to me, this was a cautionary tale to all of rural and remote America. That if we don't get our act together soon in our states and in our territories to make sure that no matter where you live in this great country, but especially in rural and remote America, that makes up over 97% of this great country's landmass, we will continue to see people die. So the stakes could not be higher when it comes to making sure that the Rural Health Caucus, the Bipartisan Rural Health Caucus, continues to stay together and fight for those most basic things that every single one of our constituents, no matter where you live, no matter what district, each one has a touch of rural, to make sure that the healthcare access and mental health services that they need will be there for them when they need it. So thank you so very much for allowing us this critically important special order hour to highlight rural health in our country. And I look forward to working very closely with all of my colleagues to make sure that rural America has the health care they need and that they deserve. At this point, I yield back the balance of my time. Thank you, Mr. Speaker.